This module will provide an overview of medical ethics and professionalism. It will introduce the core concepts and principles that underpin ethical medical practice. A brief history of the development of medical ethics will be covered to provide context. The module will then explore the key responsibilities and values that every doctor is expected to uphold, as outlined in the General Medical Council's guidance on good medical practice. Case examples will be used to demonstrate how these principles apply in real clinical settings. By the end of the module, learners should understand the historical context that shaped modern medical ethics, the 4 primary principles of medical ethics: autonomy, beneficence, non-maleficence, and justice, how professionalism and professional values are integral to medical practice, the core duties and responsibilities of doctors as defined by the GMC, how to apply an ethical framework to common scenarios in healthcare. The principles of medical ethics can be traced back as early as the Hippocratic Oath from ancient Greece in the 4th century BC. This text established some foundational rules for physicians, including vows to respect patients, practice medicine competently and honestly, and avoid causing harm. Over time, new ethical issues emerged as science and medicine advanced. In the 20th century, events like the Holocaust and inhumane research experiments led to major reforms. In 1947, the Nuremberg Code was established in response to Nazi human experiments, outlining informed consent and voluntary participation as essential. The 1960s saw further developments as doctors started grappling with new technologies and healthcare decisions. Philosophers like Tom Beauchamp and James Childress studied patterns in ethical reasoning and developed the 4-principle model that continues to shape bioethics today. As society became more rights-focused in the 1970s-80s, patient autonomy and informed consent gained prominence. Issues like resource allocation, end-of-life care, and assisted reproduction brought new dilemmas. Regulatory oversight also increased as medical practice grew more complex. In the UK, the General Medical Council was founded in 1858 and remains the regulatory body for doctors. Their guidance on professional conduct, known as good medical practice, plays a vital role in maintaining standards. The 4 fundamental principles are autonomy, respecting the right of patients to make their own informed healthcare decisions; beneficence, providing beneficial, effective care based on clinical needs, balancing benefits, risks; non-maleficence, avoiding, preventing, and minimizing harm to patients; justice, treating patients fairly, equitably, and based on clinical need, public health priorities. These principles form the ethical foundation for good medical practice. In reality, they may conflict in complex cases requiring balanced judgment. Compromise and discussion are often needed. For example, autonomy versus beneficence. A competent patient refuses a treatment the doctor feels is necessary. Beneficence versus non-maleficence. A risky procedure may significantly help one patient, but risks harming others due to resource use. Justice versus autonomy. Should taxpayer money fund expensive end-of-life drugs for a single patient? Professionalism refers to the competencies, values, and duties that distinguish an occupation requiring specialized training and expertise. As a profession, medicine carries an obligation not just to patients, but to society as a system designed to care for the ill and injured. Core values of medical professionalism include service, prioritizing patient well-being above self-interest through altruistic care; duty of care, taking full responsibility for clinical management and decisions; integrity, upholding ethical and legal standards, following through on commitments; excellence, achieving and maintaining the highest professional standards through lifelong learning. Professionalism encompasses both clinical competence and the non-clinical behaviors expected of doctors, such as communication skills, collaboration, record-keeping, and participating in quality improvement. It reflects an ongoing process of self-monitoring and development rather than a destination point. The GMC's guidance establishes these core duties. Make the care of your patient your first concern. Respect patient autonomy and confidentiality. Obtain valid consent. Provide a good standard of practice and care, taking into account individual needs and priorities of care. Keep your professional knowledge and skills up to date. Recognize and work within limits of your competence. Be honest and trustworthy. Protect and promote the health of patients and the public. Treat patients as individuals and respect their dignity. Do not discriminate against patients or colleagues. Work in partnership with patients, respecting their right to reach decisions about their treatment and care. Contribute to improvements for patient benefit. Recognize the role of other professions in healthcare. Communicate effectively with colleagues and cooperate over patient care. Provide a high standard of practice and care at all times. Let's explore how good medical practice might guide decisions in some real-world scenarios. Case 1. A doctor is asked for a medical report on a long-standing patient by the patient's family against the patient's wishes. While concern for the patient is understandable, disclosing information without consent would breach confidentiality duties. The ethical answer is to politely refuse and suggest discussing concerns directly with the patient. Case 2. An overworked doctor is considering omitting some routine admin tasks like referrals and discharge summaries to focus on clinical duties, but this falls short of the responsibility to maintain complete and accurate records, which are essential for coordinated care. The ethically right decision is to prioritize paperwork by streamlining processes or delegating where appropriate. Case 3. A doctor believes continuing intensive care is futile and causing suffering for a terminally ill patient, but the family insists on life-prolonging measures. While autonomy is crucial, the duty of beneficence towards patients means seriously considering quality-of-life issues and facilitating end-of-life discussions with family and palliative care experts. This module introduced how medical ethics and professionalism provide a crucial framework that has evolved over time in response to advances in science, technology, healthcare systems, and social values. Using cases examples, it demonstrated how key responsibilities outlined in good medical practice anchor doctors' duties to patients and society according to the highest professional standards. While new challenges will always emerge in healthcare, staying grounded in underlying principles guides doctors towards ethically appropriate solutions. Understanding this framework establishes a foundation for handling complex decisions competently and compassionately in clinical practice.